Welcome, everybody. It's Dr. Doug Pernikoff, and I have a special guest host. Marian Brickner. She's been here before. Say hi, Marian. Hi, Marian.
Hi.
And today we're going to be talking to a special guest. We have Dr. Scott Nieberg. He is the owner and manager of the City Cat Clinic, correct?
Correct.
And your address there is where, Scott?
4491 Forest Park Avenue.
4491?
Yes.
Okay.
In the Central West End.
Okay, great. Right off of Forest?
Right off of Forest Park and Taylor.
Good.
Behind the hospitals there.
And do you have a website that we'll ask you again later, but go ahead and give it to us?
It's St. Louis Cat Clinic-STL.com.
And you have a phone number?
314-652-1919.
So I have to start by giving a little bit of the history I know about Scott. Scott was in my class at veterinary medicine in Columbia, Missouri, and he also, at that time...
What year was that now?
We don't want to say.
I think Taft was president.
I don't know. Was it 76 or 75? 77?
77.
Okay, so we started in 77 and graduated in 81, and that's why we look so seasoned and mature.
You'd never know it.
Well, probably maybe immature, but that's what we are. And Scott was I was telling a funny story. I'd be cramming to get every word in that the lecturer would say, sitting right up front so I didn't miss anything. And I'd have 10 pages of notes for any class. My hand would be worn out. And I'd look back and look at Scott, and he'd be like dozing through the lecture. And then every once in a while, his arm would lift up, and he'd write something without his head moving. And then he got straight A's. So I just figured, wow. So I tried to do that one time, too. I got no notes, and I tried to do that, teach my arm to write, and I ended up with a C in the class. So I don't know what the deal was. But something maybe just kind of just...
A lot of it was osmosis, I think.
Yeah, just kind of absorbed by I think he's also a bright guy.
I used to have really good short-term memory.
That's what my dad said for many years. So the first thing I was going to have you do is tell us a little bit about history. When I first met Scott, he was interested in equine medicine, and then he got into small animal practice, and mostly dogs and cats both, but mostly dogs. And then he ended up in a cat practice. So why don't you give us a little bit of your history and how you kind of got there and why you were driven towards cat medicine?
Well, mostly when I was in school and shortly after, I was a little more interested in the horses, but most of the jobs that were available were small animal practices, and so I went into small animal practice instead. And then after years and years of doing small animal practice, I was inclined more towards the cats, and then I was thinking about finally having my own practice. You know, it's a little slow on that end. And an opportunity came up and to buy a practice, and I was also, like I say, a little more pushed to it because a few years earlier I'd had a herniated disc from lifting big dogs and had back surgery.
Know that, been there,
and you know, and every time I lifted a big dog after that, my back would seize up and I'd be laying in bed for 2 days. So
I get it.
The good news is my biggest patient's 25 pounds now, so that doesn't throw my back out anymore.
I've seen some 30-plus pound cats, though.
I have too, but right now the biggest one is only 25.
You could always have your techs lift them. You know, so that's what I always tell people, my little techs can pick up these big dogs. I said, well, I don't hire them unless they can lift at least 50, 60 pounds. So
that's actually my limit anymore is 50 pounds, which, you know, there's a
your
lot of
wife know
dogs
that
that are more than 50 pounds.
So I have a question.
Sure.
So I'm thinking about cat behavior, and I'm wondering if there's a common denominator between when a cat comes in to see you versus the other dogs when they come in to see you. Is there a different sort of feeling or what? Anything different that you could?
Is it your demeanor too? That I'm going right along with the same question, but do you feel like you kind of present a certain demeanor to cats that might have been different than presenting to dogs?
I don't necessarily think that. I think it's more that, you know, cats react a little differently in clinics than dogs, and it's rare to see a cat that's actually truly aggressive in the clinic. That 90% of the time or more, they're just scared,
Right,
and,
it's
and
fear-based.
it's all fear-based. Whereas, as you well know, a lot of times with dogs, it's not fear.
Yeah.
You know,
I think they just like to eat kosher. I don't know.
so why are they going after you?
I know.
But you know, and that's the thing that you have to try, and that's hard to deal with because, like I said, as I always tell people, when they come in and they're scared like that, they're either possums or raccoons, and obviously we like the possums because they just sit there frozen and don't do anything, whereas opposed to the raccoons that are, you know, biting and scratching and thrashing, and then it becomes a self-fulfilling prophecy at that point because then the gloves come out and the towels come out and then, you know. But the last few years we've been pre-medicating a lot of the unhappy ones with gabapentin, and that's worked really well.
So before they come to the clinic?
Right. We have the clients come
great.
in like the week before or a few days before and pick up liquid gabapentin.
Sure.
And
Which for the audience is a pain management. I guess it gives them
it's
a behavioral.
yeah, in people it's used as an anticonvulsant and also for neuromuscular pain. And it just makes kitties happy, and they come in and we usually give them anywhere from 50 to 100 milligrams of that, and I'd say it works 80 to 90% of the time. They come in happy, and we are able to do a full exam.
I wonder if that would work the
whatnot.
same on a dog.
I don't think so. I mean, I think they've been using more trazodone than gabapentin in dogs. But you can't use the liquid in dogs anyway because it's loaded with xylitol.
Oh, okay.
And my clients prefer the liquid over trying to pill their cats.
Wow. So we do use gabapentin in dogs, but we mostly use the oral. But there's xylitol in the liquid form?
Yeah. Well, it's a human formulation, so they don't really care.
Yeah. It's good to know. I better talk to my group about that one. So I personally, I do feel like with dogs, there's a very, very clear kind of my demeanor impacts them very directly. I've seen situations where I come into a room, and if I'm totally relaxed and I don't think about what I'm looking at in terms of breed or behavior, I always look, but I can usually read the animals pretty well. And I've had animals that were perfectly normal. I do an exam, and then I turn around to get the shot. And one case in particular, I remember many years ago, it was a big Akita, like a 130-pound Akita.
You're profiling there, Doug.
No, I know. But I did this complete exam. I turn around to get the shot, and the guy looks at me, the owner, and he says, "This dog's a killer." And I go, "Oh, really?" And I looked at the dog, fear welled up within me, and the dog read the fear, and that was it. I couldn't get near him. And I thought, man, I was just all over this dog. So it really does make a difference.
I've had instances like that too, where you didn't know I actually had a cat, I guess it was last month, that was kind of like that, where I didn't know. And we were sitting there handling it, doing everything with it, and all of a sudden, the owner's like, "Well, don't you think you ought to get gloves out?" And we're like, "Do we need gloves?" Well, every other vet's used gloves for him. And I was like, that might have been nice to know beforehand.
Yeah, that's
But I think, like I say, it becomes self-fulfilling prophecies at that point, because they force you to, protect yourself, and this whole fear-free thing is great, but
well, tell the people about that, because there's a whole program.
Well, there's
a
a fear-free program that's designed for both dogs and cats, and trying to make the actual visit to veterinarians, not to the point where they come in and they're calm and they're happy and they like being there, instead of lashing out.
We call that drugs.
Well, unfortunately with the cats, it seems like a lot of times it takes gabapentin for that. But with the dogs, I think they talk about starting them out with puppies and giving them treats and everything while they're there, trying to make it a happy experience. But
I let them eat a cat. I
but
just bring a cat in and say, "Here, chew on this for a while." They like that.
I think that only works with Rottweilers. But cats have very rarely eat treats in the room. I think in the last several years I've had like one cat that would do that.
Well, the other thing I've noted is that if I take a dog that's anxious or fearful out of the room, I take the owner out of the room, I get a different dog. That I don't think is the case, like you said with the cat.
A few times, but I think it's. But I only have a few clients that I've asked to leave the room.
And that was for other reasons.
It was just because their anxiety and their fear was ramping up the cat.
Yeah,
but that's very uncommon. No, but that doesn't happen very often. But I agree with you. I think that does happen more with the dogs.
Oh yeah. Marian, what do you think about?
I'm just so interested in the perception of the cat, or when the cat comes in and you say, "Hi, how's it going?" Or, "I'm going to do something to you now that you won't like," or something. So that
I think pretty much everything we do to them, they won't like.
Right.
As I always tell my clients that it's I'm actually surprised more of them don't hate us. I mean, when you think about it, they come in as kittens, we poke them, we prod them, we shove stuff down their throat. Then they come in and every time they come in, that happens. Then they come in and they get neutered or spayed.
That really messes
and so it's like nothing good ever happens when they come in. So you'd think that actually more of them would hate us and fear us. So, I mean, I think we're doing pretty good at that point. I mean, but, how do you get around that? I mean, they need their vaccines. They need their, dewormings. They need to be examined.
So, of course, you talk to them and you say, "This is going to hurt me more than you," right?
I don't know that I've ever said that.
I could try that.
I could try that. I mean, I don't know. I don't know if I speak cat well enough for it to work, but it's worth a try.
Yeah. I think so.
I do think demeanor does help. I mean, and you try and be as calm and patient as possible, but some of them don't allow you to.
Well, and I also think that being firm in the way you manage them is important too. If you're too lax and you don't take control of the animal in some way, I mean, to me, it's a matter of, in my experiences, sometimes I handle them a certain way just to get control, and I know that if the cat's going to make a break and try and do something, I've got enough hold and I'm not going to hopefully get bit. That's number one, because cat bites can be really nasty.
Yeah,
and we should talk about that too.
Yeah.
But, you just kind of, again, try and read the animal and read the owner, and I think it's a combination. I don't think people realize how much veterinarians have to read the owner as well as the pet in many cases. So, anyway, it's interesting.
Right. Well, I have this theory. This is one reason Doug invites me on here sometimes, is that there's an individual, we all know the same thing. There's an individual who lives in the body they happen to have, and the goal, of course, is to reach that individual as quickly as possible so you can get along.
That sounds cool.
Or
and
not.
That's with a little bit of alcohol.
Or so
well, I try not to do that while at work.
But really what you're basically saying is the cat comes in, doesn't really, not interested in anything except going home.
Well, I think, for a lot of cats, it even starts at home. I mean, it starts as soon as they, try and put them in the carrier or heaven forbid, try and carry them in, because that always turns into disasters. Because then like at our clinic, there's a, main road right next to the parking lot, and so these big trucks and whatnot come by, and the cat gets freaked out, and then we're trying to chase cats through the parking lot, which...
Yeah, really?
If I ever see a cat come in without a crate, I get worried.
Yeah, we do too. We keep cardboard ones there to send them home in,
right,
especially for that. But the
and I was going to say, and of course, the funny thing is, the owners really get a kick out of this. As soon as we're through, you open up the crate that they didn't want to go into at home, zap, they're right in there, and they really enjoy getting ready to go home.
They want to leave real quick. Well, I always tell people whose cats that they have a lot of trouble getting them into the carriers is to put the carrier out a week, 2 weeks, or even leave it out all the time is even better.
Let them explore.
And you just make a bed in there, leave the door open, you feed them right next to it. It helps to build a positive association with it. Some of them are just really smart cats, and they realize, I can come and go as I please, but then as soon as he closes that door, I'm in trouble. So they'll try and get out as soon as that door is closed. So, in that sense, it doesn't always work, but it has helped with a lot of them.
So we're going to take a break in just a little bit, but I did want you to think about it. I think it'd be interesting to talk about how you hire particular people, because now you're imposing something very specialized on your labor, and you got to train them a certain way. Is that correct?
The primary component for me is that I don't get bit.
Oh, protect the vet.
To protect the vet, I always tell them number one, is don't let me get bit. I get bit, you get fired.
What an empathetic guy.
Yeah, my wife has been fired at least 20 times.
She keeps coming back. Why is that?
I don't know.
Well, we're going to take just a break for just a moment. This is Dr. Doug Pernikoff and Marian Brickner, my wonderful co-host, and our wonderful guest, Dr. Scott Nieberg of the City Cat Clinic. We'll be back in just a moment. Thank you.
I want to be like you. I want to walk like you.
Well, we're back again into our second segment with Dr. Doug's All Things Animal radio show. Marian, my co-host, and myself are visiting with Dr. Scott Nieberg of the City Cat Clinic, and we've had some pretty interesting discussions so far. But we left the last segment. I was kind of interested in knowing what kind of special steps you have to take to hire people and train them to work with cats. And then I guess we can piggyback right into there. And how do you prepare your owners to present the cat to the clinic? Are there special things you suggest they do to be ready to be as comfortable as they can be? So go at it.
Well, as far as preparing the cat, then as I was saying before, they can set the carriers out. It's not the day before. That never works.
Yeah.
Because then they're wise to something's going on. It's better to either put it out a week or 2 weeks before the visit, or leave it out all the time is even better if you have the room, and make a bed and make it a happy place by feeding them near it. Sometimes even feeding them inside of the carrier helps because, again, that builds more positive association with it. There's a product, a cat-appeasing pheromone called Feel Away. A lot of people spray the inside of the carrier with Feel Away.
I thought that would deter them, no?
No, it does make a lot of cats happy.
Really?
We call it the happy cat spray. Unfortunately, it makes me cough for some reason.
Yeah.
So every time we spray it, I have to leave the room for a minute or two till it dissipates because I just then start coughing incessantly. I guess I don't do well with but and that's one of the things you can do. I mean, sometimes I think even just taking them for rides and not bringing them to the clinic helps, because there's that fear of, the only time they get in the carrier and the only time they go anywhere, they go to the veterinary clinic. So, don't always take them to just the veterinary clinic.
I do the same thing because people report all the time, my cat just meows the whole time. They get so nervous. So I say, take them into to the car, sit down, don't asphyxiate yourself, but put on the radio and the air condition and just sit with the motor running, or take short rides and let them see that it's okay. And, sometimes that helps. It certainly helps with dogs that way.
Yeah.
Cats are probably a little smarter, a little more sophisticated though, but...
Well, especially when they want to travel with them and they want to know what they're going to be like.
Sure.
And they've never gone any long distance or flown with them or anything. I always say, well, put them in the carrier and take them for a 45-minute drive, and you'll know what they're going to be like. Because if they don't like it and they're still yowling after 10 minutes or 15 minutes, because a lot of my clients only live within 5 minutes of the practice,
Yeah.
so 5 minutes isn't a real good tell. But if they're still yowling after 15 minutes, then maybe they're going to need a little help.
So let's see. Your clinic is in the city, more or less.
Mm-hmm.
So your clients live close, which means the cats are all indoor cats.
I would say 90% or more.
Do you
are
encourage it?
indoor. Yes, I recommend they stay indoors. I think being an indoor animal, they're going to have a much longer and hopefully happier life by staying indoors. I think the biggest concern we have, and this is across veterinary medicine totally at the moment, is overweight animals. And I think...
You talking to me? You talking
Well, I
to me?
was looking at you when I said that. She's definitely not overweight. So but I think it's much more than that. I mean, but I do think that the propensity to keep them indoors makes it worse because of inactivity, and then all the I guess you would say, leaning towards all these premium foods has made it even a harder thing to deal with. I don't know about the dogs. Are you seeing as much obesity in dogs now?
Oh, yeah, and irritable bowel disease, because we've conditioned our animals to eat foods that they really weren't evolutionarily designed to eat. So
well, I'm not in favor of raw diets.
I don't like the pure kibble unless it's kind of grain minimal and stuff. I don't know about cats, but it seems like in dogs that's been an issue. So.
Yeah, but that's what I'm saying, where a lot of my clients, it seems like invariably when they come in and they tell me that they're feeding grain-free, their animals gained a pound or two from the year before. And,
oh, really?
And I think that's just because
they like it more and they eat more?
That and the fact that it's higher in calories, because it isn't. There is no fiber
right,
there.
And they don't have to burn it off. When I was at the St. Louis Zoo as a zoo veterinarian and other zoos I worked at, we, in fact, would only feed the cats like maybe 4 or 5 days out of the week, and we'd let them rest. And, of course, I didn't do much in life, but the wild lion is going to go and hunt every once in a while, eat, and then sit for a couple of days and digest.
Yeah, they don't gorge twice a day.
Right, like I do.
They'd be a really good hunter if that was the case. But,
well, I have another big important topic question for cats, and the whole concept of declawing versus tendinectomy. So we do a procedure we call a tendinectomy. I don't know too many clinics that do it, but to me it's a much more humane thing. Instead of doing a declaw, which is an actual amputation, you can do this little slit right between the second phase of the digit and take out the structure there and then just glue it shut, and they heal, they go home the same day, versus the pain associated with a true amputation. So what are your conditions and guidelines, and do you have certain ages that you try and get this done before, and what's your personal feeling about it?
Well, I feel like decline, I know a lot of people don't agree with decline and are against it, and more younger veterinarians are against it. And I've always felt that it got more animals adopted and kept them in homes and kept them out of shelters, and that's the primary benefit for them. And yes, if done improperly, it can be a painful experience and can cause them issues for the rest of their life. It's like any surgery. I mean, there's good surgeons and there's bad surgeons. But I think that the younger they're done, the better.
Is there an age where you say, hey, if you're not going to do it by this age,
I really prefer that they be less than a year of age. Does that mean I don't ever do adults? Well, no, because sometimes people adopt a 3-year-old cat that's destroying their couches and draperies and everything, despite the fact they've bought every kind of scratching post imaginable and rubbed catnip all over it.
The cat goes where it wants to go.
Yeah, I mean, sometimes they just prefer your leather couch to the scratching post. But I really do prefer. I think that truthfully, when you do them really young like that, when you do them around 4 months of age, they barely notice that.
Plus, you use pain medication or something to go home.
Definitely. They all go home with pain medications, frequently with anti-inflammatories and pain medication. Sometimes if they're too small for the anti-inflammatory, it's just the pain meds. But we talk to people. We try and get them to work around it, and if they just absolutely can't, and the cat won't stop destroying things. And
have you tried the tendinectomy yourself? Because
I don't do it. I haven't been real fond of it in the past, because I think it depends on the owner being diligent about keeping the nails trimmed, and I've come across, I wouldn't say a lot, but several people who weren't, and then the cat would get caught in carpet and
plus
stuff.
It gets a lot of redundant shell.
Right, they don't clean it, because they can't control it, and so it tends to overgrow a lot easier. I had one of those just a couple months ago where
they didn't watch.
And that's the problem. People just forget about it, and they don't realize the downsides. And some people use the caps, and I think
those are temporary, though.
Yeah, most they grow out and fall off, but I think also most cats get sick of it after the first few times.
They peel them off?
It just becomes harder and harder to put them on.
Oh, I see.
And there are some cats that will let you do it their entire life, but
you're talking about little rubber.
They're little like plastic
coverings
for their what do they call them, soft paws.
Okay. Yeah,
and you have to be able to trim the nail, then put super glue in there, then slide it on.
Yeah, it's a lot to expect of a cat.
So it has to be a fairly patient cat for that.
You have to and charge extra for all that.
I don't charge near enough for that.
Yeah, for the aggravation.
It's a lot of work, and like I say, most of the time the cats get tired of it pretty quickly. But as far as I think it's and most cats, if you start them when they're really young and start trimming their nails when they're really young, I always tell them. Well, that's what I always tell people. Yeah, when they come in with a kitten, the first thing I tell them is play with their feet every single day. Don't trim their nails every single day, but even when you want to go to trim their nails every 2 weeks, if you've been playing with them every day, then they don't mind it near as much.
How about litter is another big topic. I don't know if we've got just a few minutes before our break.
You mean the millions of tons of it in the landfills?
Well, I mean, there's so many product types. And we found, we've been using one that has Cat Attract built into it. I don't know if you've ever used it.
Yeah, Dr. Elsie's. I think it's a good product.
It is.
And a lot of time, it is. And it smells an awful lot like catnip to me.
Well, it is catnip. Yeah. That's all it is.
I think
so you can buy it as a supplement.
As a jug,
Yeah, or you can buy it built into the product. Yeah. But have you ever heard of that, Marian?
No.
So I think it's just simply that. It's Cat Attract, it's called, and it draws, if you have an animal that's just pooping outside the crate or peeing right outside the crate, something, either they're not keeping it clean enough or something's attracting the animal or they're just being lazy. So if you put a little Cat Attract into the mix, then it seems to draw them. But do you have any other...
Well, most of the time
what's your spiel on that?
Wow, do we have that much time?
We can start it and we can stop it.
If you want to get into litter aversions and litter preferences, that usually runs about a 20-minute speech. But,
and do we have to pay for it?
Yes.
Well, maybe we'll just wait and we'll come back to our next section and we'll be able to talk a little bit more about it. So I think if it's okay, we're going to take a short break. And again, this is Dr. Doug Pernikoff of the Clarkson Wilson Veterinary Clinic and Dr. Doug's All Things Animal radio show. My wonderful co-host today, Marian Brickner. We're going to talk to her in a moment about her photography of cats and how that she got drawn into that. And of course, Dr. Scott Nieberg of the City Cat Clinic. We'll be back in just a moment.
Like me, take me home, Daddy. Can learn to be like someone like you. One more time. Yeah, can learn to be like someone like me.
Hello, folks. We're back again. Dr. Doug's All Things Animal radio show. And Marian was just discussing some topics with Dr. Scott Nieberg on the break. So why don't we pick up? You were asking what again?
All right. Okay. So what is the perception that people talk about cats having this haughty attitude?
Well, as I was saying, I think that it's just more that cats know who they like and who they don't like. And there's also people cats and...
Cats.
So,
cats who are more, I call them perimeter cats. They like being around you, but they don't like being held. They don't like sitting in laps.
You're describing my wife exactly.
So could you say that cats have an opinion like we all do, but they don't mind stating their opinion?
Yeah.
Clearly,
they're
transparent.
That's a good description for them. They just they'll tell you if they like you or not, and ignore you if they don't. Yeah. And we see cats from the shelter that they haven't liked anybody for years, and then all of a sudden someone walks through the door and they like that person.
So what's up with that?
I don't know. Do people, I guess people, maybe people do have pheromones that animals sense that we don't.
See, when I met my boyfriend, he was standing across the room, and I said, I want him, because there was something between us, even though he was way across the room. Do cats have that?
Was he emitting pheromones?
Yeah, what's up with that? There's some kind of chemical reaction that people have.
There has to be. There's something about that person that triggers, happiness in that cat. Finally, after all those years.
If it was me and I was walking into a shelter and I wanted to make sure the cats liked me, I'd rub my hands with catnip and I just go like this, and they go, "Oh, this is such a great person."
Or you spray feel away all over your
Yeah,
hands.
that's the attraction.
and then they didn't like you. But I know I walk into a shelter and I'm like, how does anyone decide?
I know there's so many beautiful cats. Like today, we went to the shelter with Dr. Scott. We were working on some critters and they were so beautiful. I said, "My God, there's so many beautiful cats." but they spend a lot of time there. And
Well, and that's because the ones that are social, the ones that like people and come, running right out,
they get rescued.
They get adopted quickly.
Yeah.
The ones that are shy and hide, they don't. And
Is that Animal House?
That's Animal House.
Yeah, it looked like a great place. It was very clean. It didn't smell. I was impressed.
They take really good care of them over there. They do a really good job.
And the only problem I saw was they really like and respect Dr. Scott, so we don't know what
I have
that's
them
about.
fooled.
Yeah, that's good. That's what I always say. So you were going to mention, just real quickly, what's your spiel on litter? Because that's one of the biggest questions I get, even in my dog and cat practices. What litter should I be using?
Well, sometimes it's the litter, and sometimes it isn't.
Or the box design.
Well, yeah, sometimes, they've got a little bitty box and a really big cat, and obviously it just doesn't work.
Right.
But sometimes I always start with the owner and see if the problem's the owner. Because a lot of times I have people come in, and my first question is, how often do you clean the box?
Yeah.
And what kind of litter are you using? And sometimes I get answers like, well, when I feel like it, maybe once a week. And I was like, well,
we only have 12 cats in one box.
That might be your problem. and we do always recommend a box per cat plus one. But then if the owner's been diligent, the owner's been, cleaning the box every day, and if they're using clumping litter, dumping and cleaning the box and starting fresh on a regular basis, then we start to look at is it the size of the box? Is it that the box is hooded, or is it just plain the litter? And cats tell you they like the litter by how much time they spend in the box digging and scratching. And whether they manage to bury the feces or not, at least if they tried, as I always say, some of them don't have real good aim, and they build their pyramid next to it.
That's something else my wife always complains about. But anyway.
And then we look at, is the surface that they're actually going on. And
Yes.
is the surface that they're going on a surface preference to the litter that they're using. And then I just talk to them about trying different types of litter, getting more boxes and trying different types of litter. And the things that are important to cats are scent and the scent of the litter, so always go unscented, and then start trying different textures. And as you know, there's like 50 different litters out there now. It seems
so is good old
unlimited.
clay litter, which we all grew up with, is that still an okay
I
standard?
think some cats still like it. I truthfully, in my house, that's the one that's least used.
Oh, really?
I mean, I use 5 different litters, and that's the one that I find my cats dislike the most. I think I have like one cat that likes it.
Yeah, I like the idea you're doing 5 different litter boxes.
Well, I'm trying to make them all happy.
How many cats do you have?
I can't say.
Because he's got neighborhood
you're not allowed.
restrictions.
But some of the litters, I really like this new one by Arm & Hammer. This Slide. Have you
I
tried that?
No, what's it called?
It's called Slide by Arm & Hammer, and it doesn't. When they urinate, it doesn't stick to the box. It just peels right off of the plastic, and so it keeps the box much cleaner.
Does it gel it? Is it gelling it up?
Yeah, I mean, it kind of coalesces it much better. The only downside to it is it's a really fine grain, so it tracks really badly.
Yeah. So they walk out with it.
And it's all over around the
like
box.
cat
So
powder.
if people don't like that, then they won't like it. But it's a good product. My cats love it. That's the one they like the most right now.
I'm going to try that. That sounds really interesting. So I wanted to talk a little bit, introduce one of the first things I met when met and involved myself with Marian was that she was doing a cat show, a cat photography show. And I was overwhelmed with the beauty of her work, because there are a lot of people that, I've said this before, that do photography of pets, but they just do photography of pets, and that looks like anybody's work. But her work is really artistic, and she was able to capture these beautiful prints of cats.
Here's what we did. We decided to show that there wasn't enough recognition about the importance of cats and respect for cats, in addition to the fact that they apparently have this attitude and all that. So it took 6 months. I have a studio, which currently is at Doug's house, where I went into the cat's home and set up my studio with a backdrop, and the backdrop went over, the white backdrop went over the coffee table. The cat's person was invited to put the cat on the coffee table. And that was fun because the cat would say,
I'm out of here.
I don't do coffee tables, or, and the cat was re-invited, and a couple of the cats just stretched themselves out and looked around and said, "Oh, this is just awesome." And so the pictures were either, the cats saying, "Oh my God, I never got this kind of attention sitting on the coffee table," and they're just happy, or whatever. And we ended up photographing 30 cats, individual cats, in their home, doing their life, sort of posing, and however they decided to do it. And they would come out from behind corners where, that cat never, whatever, and shows up to be there to have our chat. And we had
Cat
200
chat.
people come, and we raised a bunch of money for Lift for Life. And it was just awesome.
I'm gonna. You have a book of those profiles too, don't you know?
No, I don't have those cats.
Oh, you have the list. Okay, you have
Sure,
pictures
I have
of
a
them.
calendar of the thing, and people. The deal was, you don't pay me, we don't pay you. We're going to use the picture. In
Seems
there.
fair.
Yeah. And a couple of people said, "Please, I really want," and we're allowed to sell it. I would love to do something like that again. The condition is the cat has to decide where he or she wants to position herself for the image. So that's different from, you're going to stand here and we're going to do it. That, because it's a relationship, I can't, you understand. It's a relationship between
I used to try
the
try and
atmosphere
be a
that happens
photographer.
when I photograph a cat. And the people were saying, "Oh, she must speak cat."
Pentax, right?
Yeah,
I remember
time,
that.
God,
Yeah, yeah.
you're good.
So I'm ready to do that again, but
You guys should maybe talk about kind of a weekend event or something where you can come in the clinic and try and get photographs. It could be fun.
I don't know that the cats would appreciate that.
They probably wouldn't,
Again,
but-
you're back to the clinic thing, and
Yeah,
not
right.
they're not happy.
Now there might be. I mean, you might find 30 or 40 that are happy there
Yeah,
and would be
yeah.
okay with it. But,
Yeah, that'd be very cool.
the problem is the people. I have to go to the cat's home where she's happy.
yeah, I think that's good. I
And the
think that's-
time, as somebody says, "Well, I work all the time," it's an issue. It's a time-consuming project.
Yeah,
Let me ask you, Scott. So, in kind of a visit, do you feel like you're happy with the choice you made to get into the cat medicine versus kind of diversifying away from the other critters? Are you content enjoying one species, and do you find it drives your interest more because you have time to, look more into in depth to the cat issues?
Yeah, I definitely prefer it. I guess the best aspect to it is the fact that it's quiet. It's
Yeah.
really quiet at my
That's
clinic.
right. Yeah.
There is no constant barking in the background. But besides that, I like to spend more time with my clients, and it's hard to do in a mixed practice. You don't find too many mixed practices that give half-hour appointments.
Right.
And
In fact, in many cases, if you're working for somebody, they're encouraging you to, make money. And a lot of us actually went into this because we love animals so much, and we like to interact with the animal and the person, the owner.
Yeah, and that's what I like to do. I like to sit down and talk to them and try and dig down to the root of the problems. And if they don't have any problems, just to sit there and talk to the clients and talk to them about their lives. And
what does your
their
Google
animals.
report say?
For the most part, it's good, but they say I talk too much.
Really?
No, that's what your
Too
wife
chatty.
told me.
And
She
they said
that.
I'm too chatty. But,
Catty, chatty.
and I interrupt people.
I never
evidently.
noticed that. Hey, let me speak now, okay, please?
Okay,
No,
I'm
just
sorry.
kidding.
I have a question for. How do you?
I tell you what, let's come back because I get the signal that we're going to stop for just a second. So again, this is Dr. Doug Pernikoff, Marian Brickner, and Dr. Scott Nieberg. We'll be back in just a moment for our recap visit, and Scott has a question for Marian, so we'll be right back. Well, welcome back. We're in our final recap segment of Dr. Doug's All Things Animal radio show, and my co-host Marian Brickner and I have been visiting with wonderful Dr. Scott Nieberg. Scott, will you give us again your contact information? You're at the City Cat Clinic right down across from Jewish Hospital and Barnes Hospital?
Behind Children's.
Behind Children's,
Behind
okay.
Children's and Barnes there on
Forest Park
at Forest
Expressway.
Park Avenue and at 4491 Forest Park Avenue.
You said it was at
Taylor.
Okay.
Taylor and Forest Park. There's a strip center at Taylor and Forest Park, and we're kind of right in the center between the cleaners and the Chinese
Oh,
restaurant.
I know exactly where you are.
Everybody thinks it's hilarious. They sit outside taking pictures of the
Can you give us your website address?
citycatclinic-stl.com.
And can they send questions and stuff to your website?
No, it's a static site.
Static site, okay. And your phone number?
My phone number is 314-652-1919.
Well, I can tell you from my own experience with Scott, he's extremely bright and he's really dedicated to this. And I would say that if you have a cat and a cat problem, this is something you should look forward to and get to meet him, and you'll enjoy the experience. And Marian, I wanted to thank you for doing all the great work you do with the photography and then always helping me out. It's really great to have you here. I wanted you here because I know your love for cats is strong.
So exciting to meet you, Scott.
Oh my God, you're
Gosh.
the first person that's ever
Honestly,
said
I think
that.
I don't think I've ever had anyone say that.
Oh, they probably thought it.
Your parents probably said that when you were born.
That was the last time they said it.
Yeah, that's right.
They just
After that, it was nothing
after
but-
that, it was regrets all the way.
So I was just asking, we're going to close up here in a minute, but so we don't see that many cat shows either advertised or I just don't see them much. And do they have like activities, cat activities, like at Ralston Purina out west? And I just don't
I
see
don't
any
think
of
so. I
that
think
activity.
it's pretty
All
dog
dog-oriented, yeah.
Doggy dominated.
Yeah. So I mean, we have 1 million cats.
Poor
that are,
cats are second class.
They are second class, and yet
See,
they're-
that's why it's right.
I think they're very sophisticated. Though I really like cats.
I like them much more than dogs anymore.
And I love cat breeds, specific cat breeds. And I know that, as a rescue person, I'm inclined to focus on rescuing cats. But I do love special breed cats. I just think they're so unique and so beautiful. And really, personality-wise, they're very distinct. I've fallen in love with the Abyssinians, the Egyptian Mouse. Some of those kind of cats I think are just wonderful, Burmans and stuff like that. Do you see a lot of cat specificity, or is it mostly general mixes?
Well, we see both. I mean, I would say probably 80% of the cats we see are domestic cats, but we do see quite a few Bengals and Abyssinians and
Are Siamese still? They can be difficult
Some.
medically, can't they? I mean, they have issues.
most of the ones we see are more the apple hens, and so they're not as much the issue. Then we see a few Savannahs.
Oh yeah, I love Savannahs. Yeah.
Well, they can be challenging.
Well, I have two.
Do you?
I still have two whatchamadoodles.
Servals?
Servals, yeah, a pair. So, and a bunch of Egyptian Mouse. So we're in the process anyway. So it's been a wonderful, wonderful visit. And if you need me or if you want to get a hold of Marian, you can call my clinic, 314-761-8583. Is that it? Yeah. And, or
Don't
visit
know.
our website or Facebook for the Clarkson Wilson Veterinary Clinic. And we'd love to have you come visit with us. And again, Scott, thanks so much. It was really informative. And there's another time there's plenty of information. We might want to have you back in the future if you'll come.
Oh, well, I love to talk.
Okay, good. That's what
bring
his
a cat
Google
with you,
report
maybe.
says.
Oh, I don't know who would be able to speak for me, but
You don't do ventriloquism, huh?
I can't think of any one of my cats that would be happy being here.
We'll give him a little gabapentin.
There you go.
Anyway, I want to thank everybody again. It's been a great show. And next week we'll be back to visit again and find up some new information we'll come together with. Thank you, everybody.
Take
Thank
care.
you.